The Dewberry System, one standard for all hands-on techniques. The purpose of the Dewberry System is to create a paper-based name for every hands-on technique. Whatever your profession or the school that you attended, you should be able to read and understand a technique written following this universal protocol. By reading the name, you should be able to duplicate the technique and differentiate it from a similar one. The software associated with this presentation uses the Dewberry System as a system of reference. The main advantage of using the computer is to provide more efficient documentation and communication. Either manually or with the computer, the principles for naming a technique stay the same. Hands-on techniques are used by chiropractors, osteopaths, physical therapists, massage therapists, and physiotherapists. Hands-on techniques can be defined by the contact of the professional's hand on the patient's body or the performance of a specific action on the patient's body which involves a movement by the professional. Hands-on techniques are categorized according to the quality and quantity of the movement performed, either high velocity or low velocity, or high amplitude or low amplitude. Hands-on techniques can be divided into three major types: HVLA, high velocity, low amplitude; LVHA, low velocity, high amplitude; or LVLA, low velocity, low amplitude. HVLA, high velocity, low amplitude, involves a thrust and a cavitation sound. The patient is always passive. They may be called by different names: vertebral manipulation, adjustment, osteopathic manipulation, etc. LVHA, low velocity, high amplitude techniques are mostly rehabilitative techniques. They are sometimes used by hands-on professionals, but more often by physical therapists. LVLA, low velocity, low amplitude, consist of simple techniques such as cervical traction, pressure point techniques, but are also the cranial type of techniques and many energy techniques such as SOT, NDFT, etc. They tend to be practiced to a limited extent by all professionals. They also include some visceral techniques. To summarize, the three types of techniques include HVLA, LVHA, and LVLA. Hands-on techniques have been classified into three different types: HVLA, LVHA, and LVLA, but all have similar characteristics. Each characteristic is derived from the answer to a particular question. Every hands-on technique is submitted to a series of 7 questions. Those 7 questions are in a logical order because they follow the sequential steps in the application of a hands-on technique. A technique name is defined by 7 information blocks on a single line. Each block is called a field. Each block or field will contain the answer to any one of the 7 questions. These answers are called variables. The name of each technique is essentially a compound name made up of those 7 main variables placed in 7 fields. We should answer sequentially the following 7 questions. Note that the question order is logical: patient's initial position, doctor's position, the patient's contact, the doctor contact, the active movement performed by the patient, and the active movement performed by the doctor, and finally the patient's final position. The written name consists of 7 fields. Each variable goes in one field. Each field is encased between 2 slash marks. A total of 8 slash marks should always be present in any technique description. Whatever the type of technique used, the name is always based on a 7-variable structure. Even if many hands-on techniques do not require 7 variables to be described, there should always be 8 slash marks and 7 variables. In a hands-on technique, the name is a biomechanical description of the technique. Depending on the type of technique, it will consist of 5 to 8 variables distributed in always 7 fields. Some fields can be left empty of a variable when there is no answer to the question. Type HVLA for vertebral manipulation or adjustment. For this type of adjustment, the active movement of the patient does not exist. The patient is passive. As such, the patient movement variable is not used for HVLA. The final position is almost the same as the initial position. The movement is low amplitude. The patient final position field is not used for HVLA. Accordingly, the name will be written with 5 variables only, but all 8 slash marks remain. Note that the variable patient active movement is left blank. 2 slash marks are side by side. The variable patient final position is also left blank. Note again 2 slash marks side by side. LVHA for passive techniques includes all the techniques in which the doctor grabs a body part and passively brings this body part through a range of motion. It also includes distractive techniques such as Cox, McManus, and Leander table techniques. With LVHA passive techniques, the patient's movement is passive. It does not need to be described, and thus the variable is shown only as a placeholder. The final position of the patient is different from the initial one and should be described. For this technique, note that the variable patient's active movement is left blank. The name is written with 6 variables, but still 8 slash marks. LVHA active techniques are low velocity, high amplitude. In this example, the doctor performs an action while the patient is also performing a movement. The patient is actively lowering the right arm while the doctor is actively stripping the supraspinatus muscle from lateral to medial. LVHA techniques are mostly rehabilitative techniques. They can be active or passive and are classified accordingly. They are used by most hands-on professionals, but more frequently used by physical therapists. Each name is written with 7 variables and 8 slash marks. Hands-on techniques are used by all professions: chiropractors, osteopaths, and physical therapists. Many practitioners recognize the type of techniques by the name of their founder. These techniques include Gonstead, Thompson, Mitchell, Desjardins, McKenzie, etc. Each hands-on professional needs to change his or her habits and ask 2 questions while analyzing the movements that he or she performs. What is the velocity and what is the amplitude? Learn where to place each one of these privately taught techniques. How are all techniques classified by type? HVLA techniques include diversify, Thompson drop, toggle recoil, and activator. LVHA passive techniques include distraction table, such as Cox, Barnes, etc., and rehab techniques involving stretching, pulling, pushing, and massaging. LVHA active techniques are involved, such as active myofascial release, ART, etc. LVLA are also involved techniques such as cranial, sacro-occipital, or any other block techniques. LVHA passive techniques include traction table, traction protocol, and rehab techniques involving stretching, pulling, pushing, and massaging. LVHA active techniques include more complex techniques, such as MET and PNF. LVLA techniques include involved techniques, such as cranial sacral therapy and sacro-occipital and visceral techniques.